Health disparities are the preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations, according to the CDC. Racial and ethnic minorities throughout history have been the forefront of health disparities. Today, we are going to focus on socioeconomic status of racial minorities and how that contributes to health disparities we see today. According to Wendy Moore in Getting Real About Race, Essay 23, in 1965, President Lyndon B. Johnson signed an executive order that prohibited discrimination based on race, color, religion, sex, or national origin. By the 1990s, the idea around affirmative action changed from one about discrimination and equality to one about white innocence. Roosevelt's New Deal legislation created unemployment assurance, public assistance for poor, old age pensions, work relief for unemployed, and put federal funds into depressed local economies, though this did not apply to most African Americans. The implementation of the GI Bill and the aid of the Federal Housing Authority after World War II allowed white veterans to buy homes with low down payments, attend college, and be accepted for business loans. The result of upward mobility of whites put them in positions of economic security while unjustly impoverishing blacks. This sets the stage for the racial discrimination we see today. Since the creation of the Affordable Care Act, Americans have had the use of federally funded health insurance at their disposal. However, the statistics tell us otherwise. According to the Census Bureau in 2021, the number of uninsured for Black and American Indian and Alaska Native is 18.8%, and for Hispanic or Latinx, 17.7%, compared to the uninsured white majority at 5.7%. Racial minorities are also more susceptible to illness, diseases, and lack of overall health care they need. According to the Nebraska Department of Health and Human Services, African Americans are less likely to receive prenatal care compared to white Americans, more likely to suffer from postpartum depression, and more likely to die from cancer, homicide, heart disease, and HIV. To discuss this issue, here is a student from UNL with some personal insight.
The two most common examples of health disparities are transportation issues, such as when patients miss the bus or their ride doesn't pick them up and they can't be rescheduled due to already existing appointments that week. The second example I see is language barriers that require the use of translator apps that make it difficult to understand the severity of their pain.
Overall, history and statistics have shown us that racial discrimination is still occurring because of the socioeconomic setbacks racial minorities have faced in the past, which has hindered their health equality today.